Hi, I'm Adam, the Fertility Advisor from Verdua Healthcare Consultancy in Malaysia. So today it's time for me to do a video on case sharing. Okay, so today's case sharing is very special. It's nothing like the other ones that I've done previously. Why? Because we have received, the 100th Repugene screen report, and this is the first genetic report that showed someone, okay, I'm so sorry I can't share who it is, it's a male, okay, it's a male, that has a genetic mutation that caused him to lose his fertility. Okay, so it's natural fertility, and I'll explain that further. So you might be wondering what exactly is this Repugene screen. Now, if you haven't heard of this test before, I would strongly suggest you to go back to my previous videos and you can have a look at those, understand what Verdua Healthcare can do for you to improve your fertility and to test why are you facing such a problem. Okay, so please go and have a look at that. And if you have already done so, so I will still give you a little bit of an introduction into this Repugene screen. So anyway, this test, right, is using the most advanced technology available in this world to pick up samples, okay, in your blood. Okay, but what kind of samples do they pick up? Not hormones, not platelets or something like that, but genes. Yep, genes. So through that, it will review your genetic information and to check what's happened that made you infertile. Okay, so this Repugene screen report is separated into male and female. So male is doing one test and female is doing another completely different test. Okay, so what happened in here is that the report is separated into 3 parts. Okay, for male, all right, for male, we will check first what are the male-related problems. Okay, just to give you a little bit of a genetic knowledge to start off with. Okay, as humans, we need to have 23 pairs of chromosomes. Okay, chromosomes, gene, DNA are almost all the same, but they are just, in a different level of depth. Okay, let's just call that of depth. Okay, so chromosome is the biggest, okay, level of genes. You can say that. Anyway, so we need 23 pairs of chromosome. So on the 23rd pair, that will determine our gender. Okay, so if you have an XX chromosome, you are a female. If you have an XY chromosome, you are a male. So over this report for male genetic test, we will check out the Y chromosome. Okay, we'll pick out the azoospermia factor, meaning to say that if you have got no sperm in your sperm test report, that's what we will look into. Alright, so we will check out all those azoospermia factors. By the way, if you have no sperm, that is called azoospermia. So anyway, we'll pick up all those factors and we'll examine them very closely to see what's wrong with them. So if you have got none of those, that means if you have azoospermia problem, it could be due to external factors. For example, if you are exposing yourself to heat always, or if you are exposing yourself to radiation, chemicals, or be it touching a chemical or breathing in the chemical, that can cause harm to your sperm production function. So anyway, we'll check that. So on the second part, we will look at the entire set of chromosomes. So we'll scan all 46 chromosomes together, that means 23 pair, and compare that with the normal gene. Okay, we call that whole genome sequencing. Okay, so then we'll have a look to see what's wrong with that. But if there's nothing wrong, then the report will show, yep, 46 XY normal. Alright? So now, the case I wanted to share with you is actually related to the very last part of the report. As for male Repugene screen tests, we will test out another 5 genes. Okay, but all these genes are related to the function of the hormones. Okay, for example, we've got here AR gene that is related to the androgen receptor hormone. And so the reason why we need to check these hormones, because you see, the topic about fertility is always about hormone or the endocrine system. So without the endocrine system, fertility wouldn't be possible. Okay, ovulation is caused by hormones. Sperm production is caused by hormone. Pregnancy is pretty much caused by hormone itself. So this is something very important to look at and to explore when we talk about fertility. But anyway, leaving that aside, so this particular report, okay, will test out the 5 most affecting hormones in male fertility. So you see, there's one very special gene in here that this customer had a mutation in, okay, and that's called the cystic fibrosis transmembrane gene mutation. All right, it's CFTR, okay, in short. So many of you don't know what is cystic fibrosis. Cystic fibrosis is a very rare disease in this world, I should say, whereby it affects the function of the lungs. How? Okay, you see, each time when you, maybe in the morning or during at night, you might have some phlegm, okay, and this is part of the mucus of the body. Can you imagine if this mucus in the body becomes hardened? Okay, in scientific terms we call that fibrosis. So when it becomes hardened, it can block the channels of your organs. And when that happens, your respiratory system can get infected very easily. But if you're a guy watching this video, you need to be careful, because why? If you have this CFTR gene mutation, then the vas deferens, which is the tube that transports the sperm, will be lost as well. Okay, yes, it's all about the respiratory system, but somehow this gene, if you get a mutation in this gene, your sperm tubes will be lost. Okay. Then some of you might be asking, okay, I've read some cases whereby, or if it's yourself, then I'm going to answer this question. So what happens is that, okay, let's just use another couple as an example, whereby they have gone through 10 rounds of IVF. Okay, 10 rounds of IVF. So each time the husband tries to produce a sperm, there is, a sample, okay, there is the fluid, but the embryologist told him that there are no sperm that can be used. So what's happened? Okay, speaking from an anatomical viewpoint, okay, so what happens is that the vas deferens, the sperm tube, and the seminal vestibule are separate. So even if you can produce semen, okay, or the sample, we should say, it doesn't mean that there will be sperms in your fluid. Okay, you might be surprised, but that's what it is physiologically. So yeah, this particular customer has got such a problem. Okay, and then so what we do is that we suggested his wife to test whether she is a carrier or whether she is being affected by this problem as well. So afterwards, what we suggest them to do is that, because, alright, since he has got no sperm tube, we can do something called teasing or MESA to extract the sperm directly from the testicle and do ICSI, or so to say a more advanced kind of IVF, where you inject the sperm directly into the egg. But anyway, there's still one more problem. Yes, the baby can be born. Okay, I'm very sure that our panel clinic, with the experienced embryologists and the advanced equipment, I'm sure the success rate is pretty high. But since this is a genetic problem, it can easily be passed on to your baby. Okay, if the wife has no problem relating to this cystic fibrosis, and only the husband is affected by cystic fibrosis, then the next generation affected by cystic fibrosis is 50%. Alright. But anyway, speaking of being affected or not, there is another kind of people being affected, and these are called carriers. The carriers of a gene mutation. For themselves, they have got no problem. Okay, they don't even realize that they are a carrier for a particular kind of disease, be it thalassemia, be it cystic fibrosis, be it heart disease, be it diabetes, So that's why sometimes when you ask somebody, okay, they have, let's say, diabetes, but their parents hasn't got any diabetes. It could be that their parents are being carriers, but when it comes to themselves, they are affected. So yeah, here's what happened. So to the customer, okay, so we suggested that the wife to go for a test as well. So the wife, it turns out to be that she wasn't affected at all. In this case, the husband, we sent a couple to one of our panel and fertility clinics, and then yeah, they were able to extract 12 eggs from the wife. They were able to make 6 embryos. Okay, they had to go through genetic selection. It's called the PGS, pre-implantation genetic screening. So it turns out to be that 3 of those out of 6 embryos were unaffected. Okay, so then yeah, they were planning to implant that one maybe say next month. Okay, and we wish them all the best. So you see, the conclusion I want to draw from this video and also from the Repogene Screen report is that it's really worth testing. It really saves you money, it really saves you time, and it saves you pain and grief as well. So how do we even determine whether or not you need this test? Well, usually when a couple comes in, we will explore their family backgrounds and medical histories very thoroughly. So usually, okay, if they have been trying for a baby for 1 or 2 years, most probably the male is going to go for a sperm test, and the female is most probably going to, do something as well. So that's why they are coming into us in the first place. But anyway, for example, if we were to see that the husband's sperm morphology, meaning to say the shape is abnormal, let's say 100% abnormal, then we will target that. Okay, we will ask the male, the husband, to come and have a test to see what are the clues to his situation. All right. So then, if we were able to see that it is really something related to genetics, then we will target very specifically on that area to try to fix that problem first. But still, because this is related to genetics, there will only be a certain window of time. Let's just say 3 months or even 6 months, the longest according to our experience. So if he stops the treatment, then after a month or 2, then his sperm will go back to normal. Okay, so-called normal is very abnormal. So, but anyway, after that, usually we will send him to an IVF center, or if he really wants to try natural pregnancy, he can go ahead and do that. Same for girls as well. But next week, we will share with you on the other side of this report, the female report of the Repogene Screen. So yes, stay tuned for next week, and I hope you will click like button to support us and subscribe to our channel for the latest fertility news and case sharing. Thank you.